it's as easy as pie for me to recommend setting up practice in the Fraser Northwest.
With the development of the divisions of family practice, Fraser Northwest has just been a leader in development of all kinds of advances and resources and innovations, and it's just always been exciting to be around family docs who are passionate about what they do and passionate about making practice in general better for all of us.
Mm-hmm.
I have a bit of self-interest in saying so, but I think we have the best division in the province. And I think it really is because of the people.
Also, just the support of our division of family practice. Like, this is probably the strongest division of family practice in BC, and you know, if you have a problem, they fix the problem. So that's, I think, the great bit.
We have a wonderful community of family docs. We're well supported by the division. Right from the outset, the division has organized education events around a dinner. And it's been very obvious to me that getting together with colleagues in a collegial setting is good for all of us. There's actually studies that show how beneficial it is to colleagues to get together and share a meal and conversation, and the division provided that again for us.
Very inspiring aspect to how physicians in Fraser Northwest approach their work and see their role as advocates in the system. Really attractive when you're starting your practice to see and to have the opportunity to work in a place where so many people are so focused on making things better and making real sea changes in how we work.
If I forgot to talk about my colleagues, then I'd be silly. Like, at the end of the day, the community, you know, even though we are, you know, semi-urban, and we have a sort of a pretty good size across 4 cities, our colleagues, you know, we connect really well, you know, through division events, you know, through, you know, the networks we make. I have lots of colleagues in our community that I can call up and say, hey, look, you know, I'm having trouble with something, you know, can you know, bounce an idea off me and work with me? So I think that's one of the great perks of being here in our community.
I like the people I work with the most, I must say, because there is this sense, as you said, there is a sense of a community. It's not just me, it's not us or versus them, it's just us. And that's something which is refreshing, and you don't find it everywhere.
Fraser Northwest has just been a leader in innovations, and you know, pathways has just gone, you know, through the roof around the province, and it's just always been exciting to be around family docs who are passionate about what they do.
You know, practicing in Tri-Cities in New West, it's really unique and it's interesting. You know, we're still very urban, we're close to everything, but we have our own tertiary care hospital, and we have all the infrastructure that goes with that, specialists, you know, community resources, and you know, that makes it this nice balance of things. We're not, you know, in the hustle and bustle of, say, downtown Vancouver, but we're close enough to, you know, everything you need that we have it. Also, just the support of our division of family practice. Like, this is probably the strongest division of family practice in BC, and you know, if you have a problem, they fix the problem. The division has done so much for my practice. You know, from the top, you know, starting with helping us recruit, you know, physicians and nurse practitioners to join our office. They've been there, you know, hand in hand. You know, we had a couple of physicians, you know, retire within, you know, short notice of each other, and we were sort of panicked, like, what are we going to do? And the division stepped in right away to walk us through that. You know, as I said, hold our hand and make sure that we, you know, had lots of resources and help, so we didn't have to close our office. COVID comes, you know, we need to move to online stuff. The division is there with emails and support and staff members to say, hey, let's get you set up on virtual appointments. Let's get you a website set up. You know, let's get you online booking set up. Let's get our IT person in your office to help you work through these things. Like, all just, hey, we'll do this for you, we'll come tomorrow. And it's like, you know, the division has your back. And that's, you know, it's so satisfying to say as a physician, I don't have to worry about those things that I'm not trained in, I don't know about. The division is there.
So when I moved here, I was totally lost. I didn't know who to ask for help. I didn't know who to ask regarding EMRs and billing and the health system even in BC. And it was the division that helped me with a lot of that. It was the division staff, the division members, the other physicians in the community that are linked with the division. And I never appreciated how important that was until I think I looked back on a day which was great from a patient care perspective, and I thought, why was it great? And it was because of all the little tidbits of advice that I'd gotten from ultimately the division. And it ranges from things like the learning sessions that we have online to learn from our other specialist colleagues, the services that we have with the focus groups, and let's not forget that the COVID clinic was an initiative of the division. It wouldn't have happened had the division not stepped up and the members of the division. So it's really been, I think, at the heart of what I'm grateful for, to be practicing in here, to have such an empowered division.
We've had so much great help in terms of getting a website set up and hiring staff and organizing like our telehealth and things like that. The education things. There's been so much that the division does that just permeates the day-to-day of how I practice. I have a bit of self-interest in saying so, but I think we have the best division in the province. I think it really is because of the people.
The other thing is, I think it's great to raise families. Like, I have a young family, and many of my colleagues do too. And housing is way more affordable here. It's still quick to get around every place you need to go with transit, SkyTrain lines. Like my office, you can walk 5 minutes to the SkyTrain stop. It's so convenient that way.
Working here has been so enjoyable that after 2 years, I really did not want to move. We love the area, we love the practice, and we bought a home here. And it's our home right now, and we settled here. The area has got nice things about it. There are lots of trails, hikes around here, beautiful, famous lakes around us. And it's a very, very family-based area. I've got 2 young children. They've been loving it, we love it here, and I think, I don't really ever want to move from here at all.
I think on a personal level, the feeling that it's very family-oriented. I have a small family myself, and I really enjoy being able to, after work, be able to take my little one to the great outdoors, which is just kind of a few steps away from where we are here. Literally just a few minutes away, you can go into an area where you're completely surrounded by nature. I find that really fulfilling. I think the other benefit is really that you have a big city vibe with a small town feel here. You can really get to know people on a personal level, but at the same time, you have access to all of the resources that a very large city would have.
Historically, I don't like living in inner cities, so I like suburbs. That suits me well. I do not like to stay in traffic or to drive into traffic. It takes me about 5 minutes, sometimes 10 minutes in a bad day, to get to office and then from office to home.
It's a funny story. I can't say that I went through a whole list of communities and said that's the one. It was a bit of luck in a way. My wife is also a physician. She's a psychiatrist, and when I finished my training, she still had several years to go. And then her first rotation was actually 6 months at Royal Columbian Hospital. I feel lucky that we ended up here, but I don't regret the choice at all. It was fantastic.
I can't imagine working anywhere else because of the team of physicians and specialist colleagues we have around us, and the division that is there, very mindful, very much out in front of supporting us and helping us have the best practice we can. Like, they are there 100% to say, let's make your job easier, let's make you more satisfied, let's keep you from burning out, and to have somebody that is there, that has my back, is just so awesome.